Hi, I'm Dr. David Matlock, and we want to take a little bit of time to talk to you about cellulite. A lot of patients talk about cellulite. I think you should really completely understand cellulite so that you can understand how difficult it is to work with. Cellulite, I like to look at it as a phenomenon. So if you look at this as the skin, you have to think that there's fibers up under the skin here, and there's globules of fat growing in between, decreasing the fiber length, and it's pulling on the skin. So one thing that we want to do is try to release that. So I will take a little fork dissector and go up under the skin and release it. So if we look at this breast implant and we see this uneven surface, that which does best is a big area of cellulite, but meaning a noticeable dimple, not that fine little cellulite that you see. That's very hard to deal with. We're going to talk to you about what we can help and to help make it improve. No one can completely remove cellulite per se, but we have this big dimple, all right, like that, on the butt, on the thigh. We will go in with just a little bitty needle puncture site, and with the fork dissector that has a little blade in between, and release the fibers and to allow the skin to pop back. So if you have some areas of big cellulite that is amenable to correction, then we can do that. Sometimes what we have to do too, we would even take some fat from another area and fill it, or use a filler, something like Sculptra, to help and fill it as well. So we have it, we released it, and sometimes we do have to fill it as well. But most of the time, it's just releasing it and having it free will do the trick for us. And then you get a nice, smooth, even result. In the very, very fine cellulite is very, very difficult to deal with. But what we will do is we will take our Vaser, which is an ultrasonic unit, and then we will run it in the skin, up under the skin, okay, to help free everything up, and then to allow the body to heal, to self-heal, and give us a nice, smooth, even result. So again, big, gross cellulite is much easier to deal with, and we get a much better result in dealing with areas of deep cellulite. Thank you.